Good evening, everybody. I'm delighted to have this opportunity to speak with students and families, and I'm thrilled that so many of you are able to be with us this evening. This town hall will focus primarily on the student experience for the spring semester. As members of my leadership team and I reviewed the questions you submitted, we observed that certain topics came up repeatedly. So we'll spend the majority of our time responding to the questions that came up most frequently. And if time permits, we will address additional questions that come up in the chat. So you should feel free to add questions during this session. I'm going to start with some brief remarks and then we'll open it up for a conversation. First, let me just say a few words about fall semester. So the fall semester was essentially an experiment for us to see whether we could bring students back to campus, maintain low positivity rates for COVID-19, and provide rewarding academic and co-curricular experiences. During fall semester, we had almost 600 students on campus, with more than 800 students studying remotely. I'm pleased to say that our positivity rates for COVID for students, faculty, and staff for the fall semester were quite low, certainly lower than those in the surrounding region. 14 students and 47 employees tested positive for COVID between September and December. Now, some members of our community have asked whether we could relax our protocols since our rates were comparatively low. Unfortunately, we cannot. The epidemiologists and public health specialists with whom we've consulted have advised us that the appropriate response to the success of the fall is for us to keep doing what we're doing. As the number of new cases increases in Pennsylvania and across the country, we need to continue to be vigilant and to monitor test results and maintain restrictions. I'm grateful to all of the members of our community, students, faculty, and staff, who have been willing to think about the common good, their own health and safety, as well as the health and safety of others. Now, as far as our plans for spring 2021 are concerned, we are planning for a spring semester that looks very much like the fall. But as you know, priority for campus housing will be given to juniors and seniors, as well as to those students for whom remote learning is not possible. As conditions allow, we will open up available slots to first year and second year students who currently are on our wait list. And we'll do that after all of the emergency housing requests have been reviewed. So even though things are going relatively well, in fact, precisely because things have gone relatively well, our safety protocols for the spring will be similar to those of the fall. And we'll discuss those protocols in more detail in just a moment. Now, I know that many of you have questions about COVID vaccines. Swarthmore College has been designated as a Delaware County closed point of distribution. We are in regular communication with our local health officials, but at this moment, we don't know when or how much vaccine we will receive. We will update community members when this information becomes available. So let me run through this evening's program with you now. Joining me tonight to help address your questions are Greg Brown, the Vice President for Finance and Administration, Vero Duffins, Director of Financial Aid, Andy Fike, Associate Vice President for Sustainable Facilities Operation and Capital Planning, Mary Riley, Assistant Director of Student Health and Wellness, Jim Terhune, Vice President for Student Affairs, and Sarah Willie LeBreton, Provost and Dean of the Faculty. I'm also pleased to welcome to the conversation Dr. Peter Axelrod, Professor of Medicine, Professor of Microbiology and Immunology, and Chair of the Infection Control Committees of Temple University Hospital and Fox Chase Cancer Center. Dr. Axelrod has been working with us on our planning efforts, and his counsel has been invaluable to us. Andy Hirsch, the Vice President for Communications, will moderate this session. So as a reminder, in addition to the questions already submitted, you may use the chat function to submit your questions in real time. We'll get to as many questions as we can in the time we have together, prioritizing the ones that come up most often. Finally, please note that this program is being recorded, and we will share a link to the recording as soon as we're able. Okay, thank you. And now, Andy, what is our first question?
Thank you, Val. Not surprisingly, a number of the questions that came in prior to the event and even now in the chat are focused on the return to campus and the living experience on campus. So Jim Terhune, maybe if you could start by talking a little bit about what that return will look like in the early weeks of the semester.
Sure, I'm happy to. And I'll try and give a quick overview of things, and may depend on my colleagues here to fill in some of the gaps as we go, and we'll also have the opportunity to fill in more as we go through the program. We're very close here to the return to campus. We're about 2 weeks out, a little bit more, I guess, than 2 weeks out for folks. And so we're going to actually be asking folks who are returning to campus to start their prep work, significant prep work, actually this week. And there will be a message, I may have already gone out, a message from Mary Riley to all the students outlining information on the medical information. But beginning on Friday of this week, if you're returning to campus, we want you to start doing the daily symptom tracker. The information about that is included in the message from Mary and how to access that. And we also want you to start quarantining yourself at home for 2 weeks prior to the date that you will be returning to campus. For those of you who are able, if you're able to access COVID testing, we certainly encourage that, recommend it if possible. We understand that not everybody will be able to do it before you leave and come to campus, but if you are able to, that would be great. I know from talking with my colleagues in OSE earlier today that the majority of people who are coming back have already scheduled your move-in times. But if you haven't done that yet for the dates, February 6th through 9th, please go online there and schedule your move-in time. As in the fall, we are asking everybody to follow a pretty strict protocol. So you will have a scheduled time slot when you come to campus. You'll go through COVID testing, which Mary will explain in a few minutes. And then also check-in procedures with the staff from OSE before you go to your residence hall. And then you'll be able to go to your residence hall for the allotted move-in time, move your belongings in. I do want to say, because of the prevalence of the virus, we are limiting access to the residence halls only to the students that are moving in. So if you have family members who are going to be coming with you to campus, that's fine, but they'll need to stay outside, help you get things out of the car, but you're going to have to bring things up to your room on your own. There will be some of our staff around that will help to the best of their ability, but most of this move-in is different from what you're used to, and you're going to need to do it on your own. So just keep that in mind as you're getting ready to come in. During those first 14 days that you're on campus, you're actually going to get tested 3 times. And again, Mary will go into the details about that. Also on arrival day, we know often students and families want to run to Target or Walmart and pick things up. We know that's what you need to do. We would really encourage you to do that on that day. So if the ideal scenario is if you're able to stock up on the things you need before you come to campus in the first place, that's perfect. If you just don't have room and you need to move things in and then run out and run some errands, that's okay too. But we would really strongly encourage you to do them on that day. Because what we're going to ask is after you move in that day, we'd like people to do what we're calling a soft quarantine for the first 2 weeks. By soft quarantine, what we mean is you are not confined to quarters. You don't have to just stay in your room the whole time. But we do want you to limit your movement around the community, limit the number of people that you're seeing on campus. Those who you do see, by all means, you need to be wearing a mask and you need to be distancing at all times there. Meals will be available at Sharples, but for those first 14 days until February 19th, meals are going to be to go. So you'll schedule a time and you'll be able to go pick up your meal at Sharples and bring it back to your residence hall. We know that you may want to eat with a few of your friends. That's okay too. We want you to do that spaced out appropriately and in places, that have enough space to do that. So not in your residence hall rooms, but in common areas, or if the weather's warm enough outdoors, it would be ideal. Again, during that period, we're really going to ask that you limit your in-person interactions and distancing. Provost Willie LeBreton will probably talk about this a little bit more in detail, but it's also going to be the case that through those first couple of weeks, there will be no in-person classes. So those of you who have in-person elements of your classes, those won't begin until February 22nd. And likewise, social activities, social events. There will be events that will be virtual that will take place during those first couple of weeks. But in terms of scheduled activities and events from OSE or other groups and organizations, those won't take place until the weekend of February 19th. So that's a quick overview. Mary, I don't know if you want to talk a little bit about the testing protocol when people arrive.
Yeah, sure thing. So hi, everyone. It's nice to be here with you all, and thanks for having me here. I wanted to just quickly go over sort of our testing protocols that we have in place. I kind of think of them as two broad categories. We have first our screening testing, and then we also have our symptomatic testing. So for the purpose of just moving this along, I'm going to focus on sort of the screening testing protocols that we have, especially as it pertains to arrival. So we have two phases to our surveillance testing. And the first phase is what we consider the arrival testing, and this consists of 3 tests performed over the course of 2 weeks. So when you arrive on campus at your scheduled time, the first thing you're going to do is stop in to where we're set up to complete a COVID test. And then once we're going to be using antigen tests that first time round. And once you have your test result, you'll be able to move through to pick up your keys and move in. We do have a process in place if people test positive, but those are details that will be reserved for another time if need be. So after that first day of testing, we will be performing 2 more tests. Test 2 and test 3 will be performed at approximately 7 and 14 days after your arrival. And what that is accounting for is your travel. So what you may have brought into the community. This is an attempt to establish our bubble and to capture anyone that's coming in with maybe an asymptomatic case of COVID. So that's the arrival testing. Once we have an idea of the numbers that are coming into our community, we're going to make some decisions, and I'll be consulting with Dr. Axelrod on what our numbers are and what sort of patterns we're seeing in infection. And we'll be discussing how we're going to go forward with our weekly surveillance testing, which is our second phase. The surveillance testing is weekly testing we will be performing on either all students or a group of students, depending on our numbers, to continually screen for the possibility that there may be asymptomatic cases circulating in our community. So that's an attempt to get a jump on it if there is a growing problem. So those are the 2 ways that we're going to be doing the surveillance screening. Just kind of wrap up our other testing capacity. We do have the ability in our clinic to also do symptomatic testing. So if a student identifies that they're having some symptoms that may be related to a COVID infection, we do have the ability to do either PCR or antigen testing to confirm or exclude the diagnosis of COVID. And that holds true also for anyone that's identified as a close contact to someone who is infected as well. We will be performing testing for those people as well. I should also clarify that during the arrival testing, we will have, it'll be a combination. Each test might be an antigen or an antigen and a PCR or a PCR. We have the availability for both, but we're going to be utilizing them slightly differently throughout the arrival testing.
Mary, thank you. Jim, we've had a few folks ask about the question around parents being able to help move in. Do you want to elaborate a little bit on that point?
Yeah, I appreciate the question. And some people know that we did allow one family member to help move in during the fall. And we had hoped to be able to continue with that as the approach. That was our original plan. But because of the increased prevalence of the virus, the surge that we're working through at this point, and the numbers that we're seeing, particularly in our area, we just think it's a safer approach at this point to limit the number of people going in and out of the building.
And that might be a good time, Dr. Axelrod, to ask you maybe to speak a little bit about our conversations leading up to the decisions that we've made for the spring semester, and really just a lay of the land generally in the region.
Well, thanks so much for inviting me. I think I have sort of 2 points that I'd like to make. One of them is that, unfortunately, the epidemiology of COVID infection these days is scary. But the other point is that I think that the approach that the college is taking is really promising for keeping it okay. To the first point, the number of cases per day in the country has sort of been slowly rising since Thanksgiving. And so far, it hasn't dropped back down again. So there just are a lot more cases around. In different parts of the country, it's variable. California has about double the rate of this part of Pennsylvania. But even this part of Pennsylvania is not, trivial. The CDC has a website that has the numbers for every county in the entire country. And even within a given state, there's a lot of variation, back and forth. So I think just being cautious, no matter where you are, makes sense. The good thing, of course, is that there's going to be vaccine. And from everything we know, the vaccine is, really effective. And for everything I know, the vaccine is very safe. I got 2 doses myself working in a hospital, and it was nothing. Not that everybody has that experience, but compared to getting COVID, the vaccine is great. But the problem is that probably, I'm guessing that the number of cases will finally start to go down right around the time the semester is over. It would be great if it was before that, but we can't really count on that yet. Another issue, which I don't quite know what to make of yet, is that there are some viral mutations that seem to be changing the epidemiology a little bit. There's the UK variant that sort of came from London. And right now in the US, it seems to be pretty low. I think there've been 40 cases identified in California, but in most other states, it's like 1, 2. I think Pennsylvania has 1. But it's a little hard to judge because we don't routinely test for these variants. And around the world, there are some other variants that are a bit scary, but hopefully they'll stay away from us. So there's a lot that's kind of not really known about what's going to happen. On the CDC website, they have projections that go over the next month. And for most parts of the country and for the country as a whole, and for the Swarthmore area, it looks like the number of new cases per day is going down a little bit, they project. So that's slightly encouraging. But on the other point, which is what Swarthmore is doing, as Dr. Smith said, I mean, it just worked so well in the first semester. That's no guarantee about this semester, but what I really like about it is that people who are coming in from the community, that is faculty and staff, are tested frequently and are really being careful. And that for students, they really were really good last semester about not leaving the campus. And if you have almost no cases on campus and you don't leave it, that really is an amazingly effective way to control infection. So I'm cautiously, but quite optimistic.
Thank you, Dr. Axelrod. In light of some of what you said, and even prior to today's event with some of the questions that were submitted ahead of time, a few folks have asked, well, why not bring everyone back in the spring? I think there are probably a few folks around the table who can address that. But again, Jim, I'm going to turn back to you and put you on the spot to see if you could talk about that a little bit in the decision-making process.
Sure, and others, might want to jump in by all means. I think the basic situation in response to that question is pretty straightforward for us. We didn't know what we were getting into and what our success would be like in the fall when we opened up. And I think we were very, very pleasantly surprised at how well we did as a community in managing the virus in the fall. And so as we started to think about what do we do in the spring, the guidance that we've been getting from Dr. Axelrod and other experts we've been speaking with is, if you don't mind the cliche, if it isn't broke, don't fix it. What we did worked very well, and we believe that part of why it worked very well is because we took really significant effort and put pretty significant restrictions in place. Certainly at the core of that is having students only in single rooms on campus. There's a lot of reasons for that. The most obvious one is multiple people in one room breathing the same air over and over again are more likely to infect one another, and so forth. But there are other reasons why we're different from peer schools or other institutions. Some of it has to do with our housing stock, what the construction and layout of our dorms is, what the HVAC systems in our residence halls are like. So we felt like we didn't really want to mess with a formula that was successful in the fall. And then again, I think we're also conscious of the fact that when we opened in September and August, it was really a kind of an ebbing point in terms of the number of infections nationally. Whereas as we open up now, as Dr. Axelrod just said, we're kind of at a higher point there. And so I think we felt like we didn't really want to change things that were working. I don't know, Val, did you have anything you wanted to add to that?
Thanks, Jim. Not really. I mean, I think you pretty much covered everything I was going to say. I know that we have gotten versions of questions asking us why we did not make the decisions that other institutions made. And to your point, while there is certainly information that we can glean from each other, other institutions, I think at the end of the day, we also have to appreciate that our institutions are significantly different from each other. And so we can't all follow the same protocols. Some campuses have a higher number of singles than we do. As you said, some institutions have larger dining facilities than we do. Some are in parts of the country with lower infection rates. We could also point to institutions in parts of the country with much higher rates who are not able to open at all. So I think all of us are trying to juggle sort of common wisdom and understanding with the particularities of our individual institutions and local geography. Thank you.
Mary, we have a few questions about students who find themselves in quarantine or isolation housing. And the gist of them is basically what that experience is like, what the process is like, how they're looked after and taken care of during that process. Can you speak to that a little bit?
Yeah, absolutely. So the protocols for our quarantine and isolation housing were initially established in the fall, and they did really well. I think they were really holistic in their care, making sure that a lot of the needs of the student were addressed while they were in this uncomfortable situation of being quarantined or isolated. So for the sake of just dividing it up to make it easy to understand, isolation is the housing label we use for people that are have tested positive for COVID-19. We also use that for people that are having symptoms of a COVID infection, and we're examining if they actually do have a COVID infection. So let's just take the case of a person who tested positive for COVID-19. So the period of isolation that they would be in that situation would be about 10 days from the onset of the symptoms or from when they tested positive in the instance that they are asymptomatic. During that period, our healthcare staff will be in contact with them on a daily basis. This semester, we're going to be using electronic forms that they can complete daily. And if they need to speak with us more in person, we are open to speaking with them daily. Also, I should backtrack a little bit on the initial identification of a positive. We do have a one-on-one meeting with them through Zoom or in person, depending on the situation. We take a complete history and we do a physical exam in person to make sure that we can establish how severe the illness is and making sure they don't need a higher level of care than we can provide. Luckily, in the fall, most of the cases that were positive were not much more than cold symptoms or a headache. They were really very mild illnesses for the students. One of the really important parts of our protocol, and I think the fall will speak to this, is the availability of counseling and psychological services. I think what was probably most challenging for the students was the time away in isolation. And we do have daily availability of our counselors to anyone that is in quarantine and isolation. We have an on-call counselor that can be called any time of day if someone's having difficulty mentally coping with being in isolation or quarantine. So we do try to really make sure that that is accessible to them because we know that's a really challenging part of this situation. Besides that, we also coordinate with dining services, or some of them are located in the Swarthmore Inn. So the kitchen there supplies their food every day. We also coordinate with the academic deans to make sure that if they run into any challenges, they have the academic support that they need. If they're a student athlete, we coordinate with the athletics department to make sure, again, that as an athlete, their recovery is really important, and we want to make sure that they're well cared for there. And if there was ever a risk to the team, we would discuss it with athletics at that point as well, and take steps to make sure everyone is well taken care of on the athletics team as well. So just again, to go back and just clarify that isolation is what we use for students that are testing positive. We also use that for people that have symptoms, in which case they might be in there only for a short period of time while we complete COVID testing and rule it out. And then the third condition, quarantine, is for people that are considered a close contact to someone that is infected. There are specific criteria established by the CDC that we use to guide the identification of a close contact. And once that person has been notified, we move them into quarantine housing for 14 days from their last contact with the person. I will just note here, there was a CDC, I don't want to say it was a definitive change, but they offered an alternative of 10 days. However, they do say, and I know Dr. Axelrod has agreed with us in the past, that 14 days is still considered the gold standard and the safest for the community. So it was ultimately decided to stick with the 14 days for a quarantine period. And all of the students that are put in QNI housing have access to all the services I mentioned earlier, the daily check-ins with the healthcare, the health center, CAPS, dining, athletics, deans, all of that is universal for all the students.
Mary, thanks so much. I know there was in the fall semester speculation and misunderstanding about some of the specific quarantine and isolation housing locations and how all of that worked. Jim, I don't know, do you want to clarify some of what was out there and how that process works?
Sure. Yeah, we set aside actually several buildings because we didn't know how much space we were going to need. But we have in excess of roughly 100 spaces set aside for quarantine and isolation. And Mary, again, just explained the difference between quarantine and isolation. We use one building in particular for all students who tested positive. It's one of our residence halls. It was really well suited to it in that it's a building where a lot of the rooms have private bathrooms associated with them or shared bathrooms between two adjacent rooms. And so we're able to spread students out pretty well so that they would have a private bathroom. In terms of quarantine housing, we used a variety of different spaces. There were some of our own residence halls. We also set aside one of the rooms at the Swarthmore Inn and on the third floor of the Swarthmore Inn, where people were, very often put for a temporary quarantine if they were suspected close contacts, or in other cases, there were times when a student might need to leave campus for a personal reason for a couple of days and then come back. We had those students quarantined, and those students quarantined at the inn. So that's the answer to the question, Andy.
Jim, thanks. We've had a few questions that might split between you and Greg Brown around if folks were to change their mind about coming back for the spring semester. A, how would they go about notifying the right people? And then B, what is the reimbursement policy? So Greg, I don't know if you want to address that last piece first.
Yeah, I can start. So if a student chooses not to come back before the semester starts, obviously whatever's been paid for room and board will be refunded. If a student chooses to leave during the semester, there's a whole pro ratio schedule that's actually on the student accounts website, so that if a student were to transfer back home, they would get a pro rata refund for their room and board costs. So we want to keep the student whole as much as possible. The only nuance to that is if the student has financial aid, the financial aid award would be adjusted on a pro rata basis also. But the money out of pocket for the family stays the same. But basically that's how it would work. And in terms of notifying, Jim, I might turn it over to you, but basically everybody's already filled out the form, but you can always go back and reach out to the dean's office and let them know that you're changing your plans. I think for all of us, the way the world is changing daily, we have second thoughts. And I think that if that second thought leads you to change your mind, that's fine. The sooner we know, the better, particularly because there's a wait list for students who would like to come and join. But we really want to give you the flexibility to think this through because between now and February, a lot can happen, and we really do recognize that.
Yeah, I think I'll just quickly jump in, Greg, and say, probably the easiest thing to do is to go back through OSE where you've signed up for housing and let them know. But you could also let your dean know if you are changing your mind. We've had some students in both directions make those decisions. Some from invited cohorts who changed their mind and want to come, and others who have decided that they're going to study remotely. So by all means, be in touch with us if you have questions about that or if you want to discuss changing your status.
Jim, I'll speak slowly so you can grab a sip of water here. But we have a lot of folks who have asked about the Garnet Pledge and basically what, if anything, has changed in the Garnet Pledge since the fall.
Sure. Yeah, I glancing at the chat when I get a moment there. And I did see someone asking where they could access the Garnet Pledge. The fall version of the Garnet Pledge is still up on the website. So if you just go to the website and search Garnet Pledge, I'm sure you'll find it that way. Or go to the COVID site that's on the banner across the top of the homepage. You'll get there very easily. Most of the Garnet Pledge for the spring, we do expect will be the same. There's a few minor tweaks that are being recommended. The two big ones that I'm aware of, I'm not actually on the committee. That there's a committee of students and faculty and staff that have been working through this. And we expect to get their final recommendations here in the next day or so, and then we'll get it out. But the two biggest ones have to do with, first of all, we are requiring that students get a flu shot. If you've had a flu shot already, that's great. You can let us know that when you come to campus. And if you haven't had a flu shot, you can let the health center know when you get to campus, and they'll be able to give you a flu shot. So we're just trying to follow the CDC guidance there and get as many people immunized against influenza as well. So that's one. And then the other is, you'll recall in the fall that the invited cohorts were primarily first years and sophomore students. So everybody who was under the age of 21. We know that in the spring, we're actually going to have probably a majority of the invited cohorts who are over 21. And so I think there's a recommendation to adjust the provision about no alcohol being on campus. There still will not be parties, big parties of any sort, and there won't be parties with alcohol, but we do recognize that there are people over the age of 21. And so I know they've been working on some language to allow for that. So those were really the biggest changes. And there's some just kind of tweaking and clarifying of language where there may have been some confusion in the past. But I expect that the changes will be up and out to everybody who will be coming to campus within a week, so that you'll have the opportunity to see that all and sign the pledge before coming to campus.
Thanks, Jim. And as a reminder, on the COVID website, we do have the information broken down by audience. So there's a specific section for students and parents and families where they'll be able to find that information. There have been a few questions now coming in about academics. And so Sarah, maybe we could turn to you. One that's been repeated a few times is about the percentage of classes that will be taught in person versus remotely for those students who are living on campus. And just about the academic experience overall and what to expect this semester. Do you want to talk a little bit about that?
Sure, I'd be glad to, Andy. As Jim Terhune mentioned earlier, the first 10 days of the semester will be entirely remote. Similar to last semester, about 15% of our classes will be in person. As the weather improves, of course, there will be more options to use our tents outside for discussion and study. The on-campus experience is, of course, just for students in residence on campus. That's part of the good advice that we're following of keeping a pod from Dr. Axelrod. Our faculty are looking forward to welcoming students back. What is unchanged is that many of our courses address the most important issues facing the United States and the world. And study is far from passive. It really is preparation for engaging the complicated issues that we all are facing. While we had a break during the fall semester, it came 3/4 of the way through that term. And we learned that in the spring semester, it would be good to have that break much closer to the midpoint. So we will have a substantial break in the middle of the semester, and we're confident that will be a welcome staycation for everyone. Just because we're having the break doesn't mean folks will leave campus, but that break really should provide everyone with some relief. The past spring and fall has taught us that we all tend to imagine that we'll have more time and energy than the remote environment, coupled with all of the challenges of the pandemic, actually allow us. So for any of you students who are currently tuning in to this session tonight, if you have the ability to take 3 courses instead of 4, or 4 courses instead of 5, please do so. This is both to conserve your energy and to protect time for you to care for yourself through rest, creativity, and exercise. I'll wind up, Andy, by just saying a couple of things about athletics. So physical education will continue to offer in-person and online classes. And while there is no intercollegiate or club sports competition this spring, physically distanced practices are likely to begin again. And we do have every expectation that competitive sports will resume again next year. Study spaces and the libraries will also open after the first couple of weeks of classes. We're really excited for the spring semester.
Great, Sarah. Thank you very much. Jim, we've had a number of questions in different contexts, but all basically asking about students who may be living just off of campus and what sort of access they might have to campus in different parts of campus, whether it be facilities or coming onto campus, just generally speaking, that hopefully you can address.
Sure. This has been probably one of the more difficult issues for us to wrestle with throughout the year. We took the stance in the fall that only students who are resident students on campus could access campus facilities and participate in in-person classes and activities and so forth. We've had success with that, and so we're continuing with that. There's a few reasons for it. The first and most important one is we're trying to, while it's not a closed bubble on campus, we are trying to limit the interactions that people have with other folks outside of the campus community, just to try and reduce the potential for spread of the virus on campus and in the residential community. And the very nature of living off campus means that those students who are off campus are having regular contact with multiple other folks outside of the community. And so that just increases the risk potential there. There's another reason for this as well. And that is that we understand that some students have the means and the ability to access apartments off campus, whereas other folks, that's a more significant financial challenge. There's equity issues concerned with that. And frankly, if we worried that if we created the opportunity for folks who were living close by to participate in on-campus activities and classes and so forth, that creates an incentive to try and move closer to the campus community and do those things. And that would be an inequitable thing. And then coming back full circle on it, well, I mentioned earlier why we only have single rooms and that limits the number of people who can live in residence. We also have concerns about crowding on campus generally, and in facilities, in classrooms, in the library. The dining hall is very small and very, relatively speaking. So our ability to have people do the kind of physical distancing that's required at this time would be much more limited. But we recognize this is a more challenging issue, and I think it was probably the one that we struggled with the most as we went through this. But as long as we were going with invited cohorts, we felt like it made more sense to just limit this to the folks who are on campus.
Jim, thank you. I want to turn to dining briefly. We've had a few questions asking generally how dining will work, and then specifically about the VIL and points on one card. Greg, do you want to talk about that piece of it?
Sure. So the dining, there are basically going to be 2 dining plans, unlike the 4 or 5 that we've had in the past. And they will have extremely limited points. The only place that points will be able to be used are at the on-campus facilities, so SE's, Science Center, Kohlberg, as well as the campus and community store, since that is actually on campus. However, and this goes really as a follow-up to what Jim was just saying, our merchants, as well as our students, have concerns about cross-infection by going into the VIL and using meal points. So we will not be allowing, the same as this fall, we will not be allowing students to use meal points in the VIL this spring. I will note that's a huge hardship on the local merchants. In conversations I've had with them, they understand that as well. But the risk to public health of students coming on and off campus and interacting with people in the VIL was really too great a risk for us to take. So we are going to be working with students on making sure that the dining hours that we have are flexible enough and work for you, that certainly the first couple of weeks when it's all takeout, dining staff has worked really hard to come up with menus that are both palatable and delicious for taking with you. And I think that's an important part of their effort. I have to give that team an enormous amount of credit for really thinking about ways to serve you. Not to say you're going to like every meal you get, you never do at college, but what we really want to do is get your feedback on how we can do as best as we possibly can, but do it on campus. So we won't be letting meal points this spring. We really do hope that we can do that again as early as next year, because it's been a really important part of our economic contribution to the community. And we, by the way, have invited merchants from downtown to be suppliers for the coffee bars. So occasionally yours has been doing that with us this semester. So we're trying to keep that linkage together. But for now, we can't let students down into the VIL, or the VIL, by the way, up to you. The campus is actually closed to the community. And that is something that was a very difficult decision to make as well. But we really didn't want to have as many dog walkers and others coming on campus and breaking our bubble. So we've had to be very careful about that.
Great, thank you. Jim, I'm going to turn back to you. We've had a number of questions, not surprisingly, about mental health resources. And given the current state of things and the heightened anxiety and all that comes with that, if you want to talk a little bit about maybe CAPS and some of the services offered and how that works for our students.
Yeah, absolutely. Can't stress this enough. We know, for all of us going through this time, this is an incredibly stressful and difficult time. And we know for students, being alone a lot and studying remotely, taking classes remotely is really draining and really challenging. And so we do want to stress all the kinds of things that students can do to take care of themselves and their health. And I would certainly encourage people, I'm going to talk about CAPS, but I would encourage people to pay attention to the offerings coming out of OSC, coming out of athletics, particularly from Max Miller. There's some really good wellness programming that's coming out, on a near daily basis, on activities that folks can participate in to, be doing proactive things to be taking care of themselves. In terms of mental health services through CAPS, we're trying to make sure that people understand the full range of services that are available. I do need to explain that through a technicality that is not at all unique to Pennsylvania, but is an important thing for people to understand is mental health providers are licensed by state, and there are really strict restrictions on where they can provide services. Last spring, when we all went to COVID, there was a period of time where there was a relaxing of the normal standards there, and it made it possible for our CAPS counselors to provide remote counseling and therapy to students regardless of where they were. When we went back into the start of this academic year, that waiver had been removed. In other words, our counselors now can only provide therapy, and this is both in person and remote, and they're actually only doing remote therapy at this point for health reasons, but they can only provide therapy to people in the state of Pennsylvania. Now, for students who are on campus, any student who is on campus has full access to the CAPS staff and to the CAPS resources. And I would direct anybody to the CAPS website to get information about how to make an appointment and so forth. That also applies if you're not going to be on campus, but you live in the state of Pennsylvania. So if you're living anywhere in Pennsylvania, you can also access all of CAPS services. If you are outside of the state of Pennsylvania, then CAPS can only do kind of brief consulting meetings with you. I think they're allowed to do 3 consultation meetings with individuals. And because that's the case, we've also contracted with an outside provider called Talkspace. And Talkspace provides unlimited therapy to any of the people who are involved. In our case, all students, all Swarthmore students have full access to Talkspace, and that is good anywhere in the world. Again, there is advice, and it's 24/7. There's information about how to access Talkspace on the CAPS website. And if you had any questions, you could also email David Ramirez or any of the other CAPS staff, and they would be able to tell you how to access CAPS that way. Also, we continue to have CAPS on call, which is 24/7 for anybody in an emergency situation. You can always call CAPS on call regardless of where you are, and we will, they are available to provide services to folks. We're really trying hard to make sure we're pushing this information out to folks. So I've encouraged CAPS to be pushing this information out on a regular basis. And my hope and expectation is that will be the case. And I believe actually there's going to be a message coming from David Ramirez to the community about services within the next few days as well.
Jim, thanks. I'm conscious of the time. We're getting close to the 7:30 mark. And I know, Val, you have a few closing remarks you'd like to make. But Jim, a lot of people are very interested in what the plans are for commencement this spring.
Yeah, I saw that. And again, I think we're scheduled to put a message out to the community within the next day or so. Yeah, this is another one of these really hard messages to convey. We've looked at this. We wanted to kind of wait as long as we possibly could to keep the prospect of an in-person commencement open. But based on the information that we have from experts and all of the predictions for where we'll be by the end of May, we just feel like we have to give people advance notice and let them know that we're not going to be able to do an in-person commencement in the way that we have in the past. So we will be doing a virtual commencement, much like we did last year. And there'll be much more information on that as we go forward on how that all will work. I believe this year our hope is also to have our honorary degree recipients be able to record their addresses so that people could access those as part of the ceremony. But at this point, the idea of packing people into the amphitheater or onto campus in a large crowd just isn't realistic. So we're not able to do an in-person commencement.
Thanks, Jim. We're just about out of time. I know a few folks may have additional questions. Just a reminder that you can reach out to your deans, as Jim mentioned earlier today, if you have questions specific for them. You can reach out to housing, the health center. If all else fails, you can use the email address covid19@swarthmore.edu as sort of a catch-all, and we'll make sure that the questions get to the right folks and answered in time. And again, we will post this recording to the COVID-19 website so you can view later on if you want to recap anything that we've discussed here today. With that, Val, I'll turn it over to you.
Thanks so much, Andy, and thank you to my colleagues for participating in this evening's conversation. I also want to thank all of you, students and families, for joining us for this evening's conversation. Last semester, we discovered how much we can achieve when we come together as a community, even during difficult times. That experience makes me cautiously optimistic about the spring. I want to thank all of you, students, faculty, and staff alike, for being part of this journey as we seek to get through these challenging times. Thank you and good evening.